Dr. Mark Jabor with Cosmetic Surgery and Laser Center of El Paso. Today we are going to be performing a rhinoplasty. So this is the preoperative pictures of the gentleman we'll be performing a rhinoplasty on. So the main goals of the procedure are number one, to reduce the dorsum, number two, to rotate the tip up, and then also to decrease the broadness of the nose, both the tip and what we call the alar base. So the first thing we're going to do is reduce the dorsum. And I think you've heard me mention there's two different ways of doing it. One is just taking a file and shaving down the dorsum, but we're going to do what's called the dorsal push-down technique, which on the inside of the nose is the septum, which is the middle partition. So we're going to take off a strip of that, and the amount of septum that comes off is the amount of the dorsum will come down. And then we'll basically make cuts on the side of the nose so that this whole part can be pushed down in whole and reduce the dorsum without having to shave it and have any possibility of imperfections or problems with what happens when you do a shave. So that's the first step, and then we'll open the nose and do the other steps, and I'll show you some of the key portions as we go along. Okay, so I went ahead and did what we talked about. In the inside of the middle partition, I took off a strip of that, and then I've made these cuts here, and then had to make a little incision to make the cuts there. So the whole, I've already done the push down, so the nose has been pushed down, so you can see nice and smooth here. Let me come back to the picture over here, and you can see how much of that dorsum has been reduced. So now it went from kind of a curved or convex projecting dorsum to a flat dorsum. We'll come back one more time. So now we're ready to do what's called the open portion of the nose and start working on the tip. Okay, so we went ahead and we opened the nose. That's the elevation. Trim some of the cartilage right here. This, what we call lower lateral cartilage, makes up the tip. And then there's been sutures that were placed. So if we bring that back over, you can see how much kind of the tip has been narrowed, as well as the tip has been elevated and rotated. So I'm happy with all of that. So we're going to put some sutures to close it up. And then the last thing we're going to do, what we call an alar base reduction, which is to bring in that alar base, and that will require an incision that fits right in this natural nasal facial crease right there, and I'll show you that. Okay, so the last part of the procedure is going to be an alar base reduction. So we're going to move kind of a wedge of tissue that goes right between this ending part or the side part of the nose and the face. So that wedge comes out, and then you reclose that, and that will narrow the flare that you see right here. Depending on how you design it, if you go into the nostril, you can also narrow what the nostril aperture is as well, or you can stay out of the nostril and leave it the same size. We're going to go into it and narrow it just a little bit as well. So let me show you how it's marked on the patient. So here it is. Here's that wedge of tissue marked off. I have a 6mm wedge marked. Standard is probably about 4. We're going to go a little bit more because of kind of the width of this alar base, and so we'll excise that and close it, and you'll see how much that narrows. I'll excise, close, and show you one side as compared to the other side that hasn't been done. Okay, so I removed that 6mm wedge right here. It gets a little swollen after the injection, but if you can kind of look and see the nostril aperture, see how this one's a little bit smaller than that, and the overall base has been brought into. So, excuse me. So I'm going to do the same thing over here, and then we will be done. Okay, so we're back. We're all done. So both sides have been done. Just to kind of reiterate, we did the reduced the dorsum, what's called the push-down technique. We narrowed the tip, we elevated and rotated the tip, and then reduced the alar base. So those were the things that were done. I think the goals have been accomplished. We're going to put some tape, a splint on his nose, and he'll go to recovery room from here. I'm Dr. Mark Jabor, Cosmetic Surgery and Laser Center of El Paso. Thanks for watching. I hope this was educational.